This year, like other years, there is plenty of sessions, scientific sessions, CME sessions, sessions also for technologists. There are 14 symposia, 13 CME sessions, 4 plenary with very famous lecturers. So I think we have a lot to offer. There is also a big exhibition, industry exhibition, and I think there will also have fun. All the CMEs are online after the meeting, so people who couldn't reach the meeting will enjoy also the CME. It's important for our community. I think PET is still increasing in the number of abstracts submitted. New tracers, new radiopharmaceuticals are also of huge importance. And mostly the scientific content focus a lot on the use of bioimaging in the management of therapy, in all fields from oncology, cardiology, neurology, and from the beginning, do we have to treat the patients, to the follow of these therapies. Nuclear medicine in France is quite a big specialty nowadays because we have more than 200 nuclear medicine departments, more than 600 gamma cameras, and 1/3 of them equipped with a CT, more than 115 PET CT machines, 31 cyclotrons. For example, 4 cyclotrons are only for research. Also, there is a big field of research on bioimaging in France, with more than 80 groups, more than 1,000 people. And these last 10-12 years, there was more than 15,000 papers published in journals of imaging. And a quarter was on nuclear medicine. And this research is structured all over the territory by a network, a research network, who is called France Life Imaging for all in vivo bioimaging research.
Thank you for the invitation. Biomedical imaging and therapy for personalized medicine emphasizes better what we are doing. Nuclear medicine is not very clear. People have fantasies about that and think about terrible things, but biomedical imaging emphasizes that we are imaging a biological process. We are able to visualize what is happening in the body in healthy people, but also, of course, in people who are ill. And if we can image that, we can also follow the process, and we are able to visualize what's happening during treatment. So it gives us a lot of opportunities to really attract attention to the biological process in the body. Nowadays it's very interesting because we are all focusing on personalized medicine in many ways, which means that we are trying to find medications, treatment, which is dedicated to a specific situation for a person or a small amount of patients with a specific disease. And if you are able to focus on that, have the means to visualize that, then that makes you very strong. I don't think there are so many barriers. There are issues there were issues in the last few years about collaboration with the radiologists, and there are organizations with regard to authorities in Europe which are not aware of what nuclear medicine is doing, but it's not more than that. There are some minor issues like radiation protection. We have to be very aware that we use a small amount of radiation and have to defend that on many platforms, especially towards the authorities and sometimes also to patients. But that's not a real issue. We can handle that. We have the knowledge, and we are able to demonstrate and to defend what we are doing. What we found out in the last 2 years is that we can collaborate with them. A younger generation is coming up, which is more interested in education, collaboration, finding ways to give the best presentation of how we should study a certain type of disease. And the elderly medical specialists who want to fight, who are speaking about taking over, etc., is slowly moving away. So things improve, absolutely. And in the next few years, there will be more collaborations. The next scope is that we need funding. You know that the EU granted a lot of money, more than 63 billion euros for research. And nuclear medicine needs a lot of money for research, and we want to be part of that, and we want to find partners to receive money for the research we want to perform. If we can do more in the area of research, we can find better radiopharmaceuticals and improve in the area of personalized medicine. And if we are successful in that area, we can present that to the European organizations. See, this is a new tracer which is able to visualize this specific type of disease. It could be partners from other clinical organizations, which means, for instance, cardiologists or oncologists, but also from areas like radiation oncology or radiology. And it depends on where we are focusing on. So these partners will change depending on the issue we want to study. The heart of the EANM is within training and education. We have a European School of Nuclear Medicine, and in the school we organize training in Vienna, all kinds of courses for nuclear physicians who want to be trained in nuclear medicine, but also together with radiation oncologists. We give presentations in the Middle and Eastern Europe, and so there are many issues related to education, and that is the main task we have, to educate and to train our young residents, but also to train the elderly medical specialists who want to improve in their work. Then we have the scientific side of the EANM. We have a lot of scientific committees working on different issues, and education and science are the most important issues within EANM, and we have to remain focusing on that. And then there are organizational things. ExCom spends a lot of time on organizational things, make ourselves visible to all kind of other organizations, but it is more about future, making ourselves present, etc. My highlights are the meetings during the days. I won't be able to listen to any of the presentations, and for me it's more meeting colleagues and friends, not only from the EANM but also from other countries. We have visitors from the US, from India, from Japan, so we have a lot of meetings and trying to make plans for the next future. And these plans are also related to education and training, but also to research. I hope I can go to some presentations, at least from my own hospital. There are 21 presentations from my own hospital, and I'm not able to visit more than 2 of them, but it's important as well. The most important ones for me are make ourselves visible. The EU should know that if they discuss personalized medicine, biomedical imaging, they have to go to the EANM. And it is not easy to do that because most authorities are not aware of nuclear medicine. So we have to go to the European Committee, we have to go to the European Parliament and find the bodies who are interested in this. And I think that is a very important issue for next year.
Well, the annual Congress is the most important event each year for our community. And I think it's because it's the only place that everybody meets every people involved in the field of nuclear medicine. Doctors, of course, but also technologists, physicists, radiopharmacists, industry, whatever. All partners are here. And it's the only occasion you have to meet all together.
People come for science. They want to learn the newest ideas. They want to learn about innovations. But they also want to meet colleagues and friends to hear about their ideas, how to treat patients, how to perform diagnostic procedures. So it's the focus is on education and innovation, but also a little bit about meeting colleagues and friends and enjoy some time together and remember this meeting as a nice meeting in 2013 in France.
When I was young, I used to be a cardiologist, and I moved to nuclear medicine because I thought it was really innovative and had a lot of new ideas, new tools for healthcare. And nuclear medicine represents biology in vivo. And that's a tremendous field of improvement of healthcare. And really, it's fulfilled all my expectations. I'm very happy in nuclear medicine.
I was also trained as a clinical doctor, in this case in internal medicine. And at the end of my training, I started working in the Department of Nuclear Medicine for research. I liked the research, I liked nuclear medicine, so I added the nuclear medicine training to the internal medicine training, and was able to work in a hospital where I could spend time as a specialist in internal medicine for 1 day a week, and the rest of the time in nuclear medicine, and also do some scientific work. For me, that was the ideal combination: see patients, do research, and work in a laboratory facility. It's an absolutely fascinating and always thrilling combination. Yes, and so in that way, it's up to my expectations.
Well, it's a difficult question for a doctor and for a researcher, but I will try to answer. Management is important in all the fields of medicine. I am a chief of a department, I am the chief of a research group. So, of course, there is a lot of management of human resources, management of money, financial resources, management of laws. We have a lot of rules in nuclear medicine with radioprotection, use of radiation, role of radiopharmacies, and so on. So we have a big part of our work who is management anyway. And that it's very important to be efficient, to use public resource with the best efficiency.
Dominique said it very well. Nowadays, because of economic problems, also the resources for the hospitals are decreasing everywhere in Europe. So what you see is that doctors perform diagnostic procedures in a more stringent way. They think twice before they ask the nuclear physician to perform the procedure. So the result is that we perform less studies, and that in many situations that is good because we save money and we save radiation to the patient. But it is also a challenge for the hospital and for the Department of Nuclear Medicine how to handle that. And I think we are approaching a point that we are able to work very efficient, save as much money as we can, and meanwhile improve the quality of the procedures. And I think that is management, but it is management on the hospital and nuclear medicine department level. And we have to spend a lot of time on that.